Do you have endometriosis? Hi, friends. I'm Dr. Natalie Crawford, a board certified OBGYN and REI. I'm a fertility doctor, and this channel exists so that you can learn more about your body and your fertility. Please subscribe, like, and share so that we can help more people understand their reproductive health. Endometriosis is quite common and not diagnosed nearly enough. The true prevalence is even higher, most likely, than we even know. Currently, we say 10% of women worldwide will have a diagnosis of endometriosis, and that doesn't even account for all the people who don't even get a true diagnosis. When it comes to endometriosis, the average time to diagnosing is 7 to 10 years. So, what are signs or symptoms you could have it, and what are risk factors, things that maybe you could be aware of? Endometriosis is ultimately an inflammatory condition with an autoimmune component. Your body responds abnormally to essentially normal cells. And what this results in is endometrial like tissue depositing and developing outside the uterine cavity. And we call this the abdominal cavity or the peritoneal cavity. And that tissue can deposit in a variety of different places. Where the tissue is often determines the symptoms you have. But the big overarching principle is that it's hormonally responsive tissue, essentially like the endometrium, grows in response to estrogen. Sometimes progesterone will help it, but another hallmark feature can be some resistance towards progesterone. But there's an autoimmune attack to the tissue, causing inflammation and ultimately pain, which lead to some of the top symptoms of the disease. Very importantly, you can have endometriosis and have no symptoms. The diagnosis is officially made by surgery. That being said, sometimes physical exam, sometimes ultrasound can lead to a diagnosis, but just because your exam or your ultrasound were normal does not mean you don't have endometriosis. It is one of those things, if we think about it at a cellular or microscopic level, you cannot always see that, especially on an ultrasound. I talk about endometriosis a lot because up to 40 to 50% of patients who have infertility have endometriosis, and especially if your infertility is unexplained. That means it's really just undiagnosed, and there's a lot that we don't fully know about this disease yet, largely because there's been a lack of research and funding in women's health diseases, but that's a separate topic. When it comes to understanding what your signs and symptoms may be, this is really important. Number one is going to be painful periods. So, pain and cramping when you have your period. Now, a lot of people have cramping, so what is abnormal and what is out of proportion? What is out of proportion, how I always refer to it, is going to be if it's going to impact your activity of daily living, or if you could, it would. If you would stay home from school, you would cancel plans to your favorite restaurant. You just want to curl up in bed because the pain is so overwhelming. If that pain is coupled with passing out, vomiting, that is not normal and you should get an evaluation. Number two is going to be pelvic pain that is otherwise unexplained. So, yes, when you're having your period, you tend to have an intensity of pain, but because of these implants, because of the scarring, because of the higher incidence of having endometriosis cysts on your ovaries or your anatomy being abnormal, you can have pelvic pain at other times. Your pelvis has nerves that don't always make sense. So your brain sometimes has a very hard time saying this is exactly where the pain is. And we know this, like the classic when you have appendicitis, your appendix, you actually first have pain at your belly button before it moves to the right lower quadrant. So neurologic pain can be really tough to understand in the abdomen and pelvis. But having persistent pelvic pain that's not explained, especially if it always feels like it's in a similar area, that is the second sign. Another symptom, so number three, is going to be pain with intercourse. And intercourse isn't always going to be pain free, but the classic associated with endometriosis is not an insertional pain or a vaginal spasm, but a deep pain. And the reason why is those implants, one of the top places, is going to be behind and in front of the uterus, what we call the cul-de-sac inside the body. And this is essentially the top of the vagina. So when you're having intercourse, that deep insertional pain Something people tell me all the time is certain positions. Some positions are less painful, maybe like missionary, but certain positions, perhaps being on top, cause more pain because of the angle and where the area of inflammation or scarring can be. Number four is going to be pain with urination or bowel movements. Now, this one's not nearly as common, but certainly you can have endometriosis implants on your intestines or on your bladder, and that can cause a lot of pain. And so, if you're constantly having pain when you have a bowel movement or you use the restroom, that's not normal and that should be evaluated. Number five is going to be other GI symptoms. And one thing we know is that women with endometriosis very often get misdiagnosed with IBS, irritable bowel syndrome, because very classically, you get this rise of inflammation, especially before or when you're on your period, and you see an increase in bloating, nausea, vomiting, diarrhea, constipation, and this is always happening, usually associated with fatigue. So it's more than just, oh, I'm PMSing a little bit. It's a very classic symptom associated with a high inflammatory burden in your abdominal cavity. So fatigue, nausea, lack of appetite, and GI changes. So if you have IBS, but it seems to be cyclic, if you're watching your period cycle, that is something to pay attention to. And then number six is going to be infertility. Because of the inflammation, we see a lot of patients with endometriosis have a harder time getting pregnant. Eventually, this inflammation can lead to scarring, and that is how we stage endometriosis. But even in early stage disease, we see infertility because inflammation, for lack of a better word, is toxic to the egg sperm early embryo environment. Very often, you'll have pain symptoms and might get put on birth control pills or progesterone hormones or contraception to try to deter the growth of this endometrial tissue because it grows in response to estrogen. The ethinyl estradiol in the birth control pill is different and doesn't stimulate growth in the same way. But really, the important piece here is that progesterone, that constant progesterone exposure to try to limit the response to estrogen and limit the growth. No hormonal contraception is going to get rid of these implants. No hormonal contraception is going to cure you. And even if you have surgery, you get the diagnosis, you can excise and get rid of these implants, very often they come back because think about it as a wiring in your immune system. That being said, because so many people get put on birth control or hormones for pain, this diagnosis can be delayed. So if you're stopping the birth control pill and you start noticing some of these symptoms coming, that is also something to think about. If you're on hormonal contraception, we aren't relying on your hormones. So a lot of these things we can't get to a full diagnosis of. If you had pain as a teenager or an adolescent, like excruciating pain or pain that kept you home from school, that is a very high predictive factor that you might have endometriosis. If you have a first degree family member, so 6 to 7 times increased risk if you have a first degree family member, so a mom or a sister that has endometriosis. So there's definitely a genetic tie, like we see with all autoimmune disease. And then starting your period earlier or having periods closer together does increase the risk. And the reason why is that more ovulatory cycles is more estrogen exposure. So, in the same time, having more pregnancies, breastfeeding longer, starting your period later, and having longer menstrual cycles results in a lower risk because you have ultimately fewer times that you're ovulating and your body is making estrogen, which is part of the process of having this endometrial like tissue response system. A lot of these things you can't control. If your mom had endo, if you had periods early, and if you have pain, there's controversy in how you diagnose the disease. And it's my belief that if we approach this from an anti inflammatory standpoint, we can improve some of this, even though we're not going to cure it. But what's essentially important is that if you can get to this diagnosis earlier, women with endometriosis have a higher rate of infertility, have a higher impact on their daily living, go into ovarian failure or menopause earlier. So, getting this diagnosis allows you to make decisions and understand your body the best possible. And ultimately, that is my goal. Endo can be very confusing, very controversial. Let's ask questions below so we can do a follow up video. As always, you can get more information on the As a Woman podcast, and you can follow along on Instagram at Natalie Crawford MD. Thanks, friends.